Thank you. Let me see by a show of hands, anybody that has been affected, if you know somebody that's been affected by heart disease. Can I see a show of hands if you know of somebody whose life has been affected by heart disease? That is just about everyone. And that's not a mistake. 800,000 people die per year from heart disease. It's the leading cause of death in America. That is every 40 seconds, somebody dies of heart disease. As a Black American, my risk is 70% greater than my white brethren. So, I would like to show you what this looks like. I show you Evelyn Oswick. You see, Evelyn Oswick, while she was in her 50s, suffered from 2 heart attacks. She required angioplasty to widen her clogged arteries, and she had a triple bypass surgery. In addition to that, that didn't work completely. She needed another bypass. And guess what? At that point, insurance wouldn't pay for it. At 60 years old, the healthcare professions sent her home to get her affairs in order because they could do nothing else for her. Most of us realize that something isn't quite right when they get a diagnosis of either high blood pressure or high cholesterol. And that's how my story started. You see, in 2011, I was diagnosed with high cholesterol. I was given a prescription, and I didn't want to take it. I also had high blood pressure. And I was scared to death. Why? I had seen my beloved grandmother have high blood pressure. She passed away of a heart attack. My favorite Uncle Peg, the guy I love playing checkers with, he had high blood pressure, and he passed away of a heart attack. I figured my time is coming up. I've got high blood pressure. I've got high cholesterol. I asked my doctor, what can I do to lower my blood pressure, to lower my cholesterol that doesn't involve drugs? I had seen that it didn't work in my family. My doctor said, it runs in your family, not much that you can do, but deal with it. I didn't like that answer. Would you like that answer? So I figured, let me look on the internet, how can you lower blood pressure and cholesterol with food? Now, have any of you ever looked for something on the internet and got one straight answer? I had one thing said, the wheat belly, man. You can't eat wheat. I saw another guy that said, put butter in your coffee. Butter in your coffee. And then there's another guy that says, well, if you got this blood type, you need to eat this way. If you got this blood type, you need to eat this way. Well, what is right? So let me tell you what I found. My search, I knew that I had found something special when I found Dr. Caldwell Esselstyn. You see, Dr. Esselstyn wrote this book called Prevent and Reverse Heart Disease, where he took patients that had severe heart disease and he put them on a whole food, plant-based diet. Now, what did they have to eat? They had to eat wonderful fruits, they ate whole grains, they ate vegetables, and they ate legumes, which is anything in a pod, beans, split peas, and lentils. Okay, well, he wrote the book. Let's see what he wrote about. Well, he followed 198 patients that had severe heart disease. I mean, some people had open heart surgeries, they had had heart attacks. I mean, they were really in bad shape. He trained them on how to eat whole food, plant-based nutrition. And he followed them for 3.5 years. And let me show you what he found. First of all, there were only 21 of the 198 that said, this is too restrictive for me. So I will just stay with my current physician's care. But 177, 89% of them stuck. They gave up the chicken wings. They gave up their ribs. They gave up bacon. Who doesn't love bacon? But they gave it up and they stuck with it. Now, what kind of results did they get? Okay, for the 21 that decided to stay under their doctor's care, how many of them got better? None. You see, we have the best healthcare system that money can buy, but it can't reverse heart disease. We're going to talk a little bit why that is. Now, the people who were on Esselson's program, of the 177 that did it, 144 got better. 81% got better compared to 0%. Now, what side would you want to be on? Right? Now, there were actually a couple of cardiac deaths on the side of people that decided to stay under their doctor's care. However, of the 177 that decided to eat whole food, plant-based nutrition, there were no cardiac deaths. Now, I thought that was good, but wait till you see this. What you're looking at right here is a coronary artery. That's a main artery that's in the heart. And this is a picture of a clogged artery. And if you take a patient that looks like this is a picture of the same patient, the same artery, with no medication, with no stent, with no angioplasty. Just eat whole food, plant-based nutrition, and that's how that same artery looks, same person. That is the reversal of heart disease, and there is no medical intervention that's possible of doing that. Only food. After I saw that, I said to myself, I know what I'm going to do to try to lower my cholesterol and blood pressure. Now, you may be wondering, well, what do you eat? You eating a bunch of salads? Is that all you're going to eat all day? Well, I want you to know I ate banana pancakes. I ate stir-fried vegetables. I ate pizza. Did you know you could eat pizza without the cheese? You can eat pizza without the cheese. Who knew? I thought pizza and cheese were like linked, like you can't take them apart. You could actually have pizza without the cheese. I had oatmeal with the fruit in it. Man, I have vegan sushi. Who thought there's vegan sushi? I ate vegan sushi. And that, my friends, is an omelet. It's a tofu scramble omelet. It tastes fantastic. I'm not talking about bland food here. I'm talking about food that is delicious and food that's got the power to reverse heart disease. Now, what happened to me? 6 weeks, my total cholesterol went from 240 down to 132. 6 weeks. My blood pressure, which was at 135 over 85, dropped to 117 over 76. I lost 20 pounds. Now, I wasn't trying to lose weight, but I lost 20 pounds. And I thought to myself, the number one cause of death in this country is heart disease. We're treating it with stents. We're treating it with angioplasty. Do you understand how severe open heart surgery is? You take a saw to the sternum, cut through it, use a crank to crank it open in order to get to your heart. You cut your leg here, and you grab an artery, and you stitch it to your heart, and you go around the clot. That's one bypass. And then you take another artery out of your leg, and you stitch it from your heart around to the other artery. That's double bypass. And then there's triple bypasses. There's quadruple bypasses. And we do all of that, and we think that that's kind of normal. But guess what? And you think eating plant-based is severe. How can that be severe? And I'm just saying eat some fruits and vegetables. Because the real truth is that food is the cause and food is the cure. Let's talk high blood pressure. 100 million people in this country today have high blood pressure. We treat it with medication. The number one doctor's visit, the reason for a doctor's visit in this country is high blood pressure. We take tons of pills, but guess what? Food is the cause, and food is the cure. High cholesterol. 78 million people in the country today have high cholesterol. But say it with me, food is the cause and food is the cure. So my question is, why don't the doctors tell us that? I see some people waving their hands there that say it is the money. And I say that that is absolutely part of the reason, probably the whole reason. But with regards to doctors, there's a couple of reasons. There's actually some more reasons than that. And by the way, I spoke to some physicians to ask them, why don't you prescribe food? Because food is the cause, food is the cure. They told me, number one, they don't get any training in plant-based nutrition. Now, I just showed you proof, graphic proof, that food can reverse heart disease, and they don't get any of that training in medical school. That's one reason. Number two, there is a pressure to prescribe. If you've got elevated blood pressure, elevated cholesterol, and you don't prescribe as a physician, that's considered giving poor quality care. Third, it takes some time to explain this to a patient. How much time on average do you get to spend with your doctor when they come in? 10, 15 minutes. So they don't have time to explain. And last, doctors are feeding their families meat, cheese, dairy, eggs. I have a question for you. What do you think the number one cause of death is amongst heart doctors? Heart disease. The leading cause of death among heart doctors is heart disease. In other words, they don't know. So they can't tell you that you need to change the way you eat because they don't know. Now, I wanted to go back and visit with you about Evelyn Oswald. You see, as a reminder, she was 60 years old, and she required another bypass surgery. Insurance wouldn't pay for it, and she was given a year to die, but that's when she joined Dr. Esselstyn's program. And here she is, 21 years later, dancing at her 50th anniversary. She lived another 30 years. After given 1 year to live, she lived another 30 years, and she passed away at the ripe old age of 90 years old. Ladies and gentlemen, that is the power of plant-based nutrition. Thank you. Thank you. Thank you. Thank you.